Welcome back, friends. So listen to this. Heart disease is a leading cause of death in the U.S. And in Saginaw, rising obesity rates put more residents at risk. So how can we change this alarming stat? Well, it's my pleasure to have Dr. Charles Bloom from HAP joining me today. Thank you so much for being here. How are you?
Thank you for having me. Great.
Of course. Now, we want to get heart healthy, doctor. So how dire, first of all, is the prevalence of heart disease in Michigan?
Well, we are just coming out of February, which is Heart Month, and we're now in March, which is Kidney Month. So they actually both are directly related. Heart disease is the #1 cause of death in our United States. Despite other rises and falls of other disease states, heart disease still remains the #1 cause. So it's certainly an opportunity. The great thing and the challenging thing about heart disease, though, is that 5 of the primary risk factors are modifiable, things that we can do to impact our outcome and reduce the impact of heart disease for those individually and certainly those that we love.
Let's talk about that. What do we need to do? How can we change this?
So it's really simple. They are basic, life functions. So the biggest risk factors would be obesity, would be smoking, cholesterol, activity, and the ability to maintain diet and weight control is really important. And then the other is diabetes. So as we talk about heart disease, kidney disease, diabetes, and high blood pressure or hypertension, all are related. So if we really break it down to the basics, simple things like exercise and movement, diet, which can be a challenge, certainly with the convenience and the challenges around maintaining a heart-healthy diet. Simple things like whole grains, fresh vegetables, fruits, lean protein, those are all things that sound really simple and frankly should be, but can be a challenge. I have 4 kids. I'm a very busy professional. It's challenging to meet the needs. So certainly can relate, and we all have our own stories of why it's difficult to exercise, why it's difficult to eat good food and nutritional food that has value as opposed to convenient. So if we think about those things and make that commitment ourselves, you really will help, obviously your own health, but as you think about the rationale and the reason to push yourself to do so, is think about your loved ones. Think about what those long-term effects might be. And things like blood pressure and diabetes sometimes can be hard because you don't have an immediate problem and an immediate impact, but certainly years down the road, you'll have long-term effects. So it's hard to remind ourselves, certainly as a physician, the concern is we don't always want to be nags, but we want to make sure that our patients understand where there's opportunity to make an impact on your own health.
Of course, you're concerned about their health. Okay, are there some community health programs to really help address these issues?
There are. So, each community has a number of things like food banks. So as we talk about nutrition, so nutrition is not the same for everybody. So thinking about where you live, what resources you have, certainly there's food banks that provide fresh vegetables, fresh fruits. The lean protein sometimes can be a little more challenging. So thinking about some of those resources in the community you live, they're definitely available. Insurers. So I work for an insurer and a health system. We certainly have lots of resources available, can make contacts with community-based organizations to make sure that we have the ability for our patients to eat healthy, to get healthy food and have access. One program we have is around, for our Medicare patients, is Medicare actually allows us to provide a benefit, so say you can have a debit card to be able to go spend on food resources. So you can actually go purchase nutritious food and have the ability to do so at the expense of the benefit. So aside from just the community benefit resources, often payers will have resources and availability to help both in the Medicaid population and the Medicare population.
Oh, that's great. Great info. We appreciate the valuable information that you brought us today. Thank you so much.